From New Hampshire Public Radio, I'm Peter Biello, and this is the Weekly New Hampshire News Roundup on the Exchange. Coronavirus is popping up across the country. What is New Hampshire doing to prepare for its arrival? New Hampshire joins an effort to investigate the marketing and sales of vaping products by Juul Labs, and the Department of Veterans Affairs is having trouble paying private doctors who treat veterans. Congressman Chris Pappas will join us this hour to discuss this and other issues. If you have questions or comments, send us an email. The address is exchange@nhpr.org, or post on our Facebook page. Just search for NHPR Exchange in Facebook and you'll find us there. You can also find a live streaming video of this radio program today on our Facebook page. Again, just search for NHPR Exchange while you are on Facebook. Dean Spiliotis, civic scholar in the School of Arts and Sciences at SNHU, joins us this morning. Hey, Dean.
Hi, Peter.
So we're going to spend a few minutes recapping some presidential primary news this week. We've got the South Carolina primary election tomorrow. After that, we're going to speak with state epidemiologist Dr. Benjamin Chan about the state's efforts to prepare for the arrival of the coronavirus. So if you have questions about that, send us an email now so we can bring your question into the conversation. The email address, exchange@nhpr.org. You can also send questions about other things as well, about presidential primary politics. We hope we can get to that as well. So, Dean, broadly speaking, Tuesday night's Democratic debate seemed, in retrospect, like a lot of shouting over one another. There were lots of candidates speaking simultaneously, made it hard to sort of hear what they were saying. Is it possible, Dean, to say that there was a winner out of Tuesday night's Democratic debate?
Well, it's true. The last two debates, the Las Vegas debate last week and the South Carolina debate this week, both of them had a bit of a feel of the free-for-all. There was a lot of shouting, a lot of cross-talking. The South Carolina debate in particular, the moderators really struggled to keep control of the event. The Las Vegas debate last week really focused on Bloomberg as the newcomer to the field. But this one in South Carolina that we just watched really focused on Bernie Sanders as the front runner. And, I think part of what we're seeing in these debates is a function simply of the size of the field. Part of it is kind of the intensity and in some cases desperation over the realization that we're going to have Super Tuesday this coming Tuesday, and then it's quite possible it may be difficult to catch the front runner, should that be Bernie Sanders. So for this particular debate, was there a winner? Well, Joe Biden, who's been very uneven in these debates, had his best night. Whether or not you want to call him the winner, we could debate that. But nonetheless, he needed to have a really good night to solidify his lead in South Carolina. He's been leading in South Carolina by large margins the entire time, but there was some concern that Bernie Sanders coming out of New Hampshire, Iowa, New Hampshire, and Nevada was gaining this kind of unstoppable momentum. So, at a minimum, Biden is now up pretty comfortably in South Carolina over Sanders, on average by about 10 to 12 points. And so, at a minimum, it has kind of stalled Sanders' momentum, but only temporarily. Sanders has already really moved on to Super Tuesday. He's not even going to be in South Carolina tonight. He's moving on to the Super Tuesday states. He's been advertising heavily in those 14 states. So the name of the game is for Biden, for him, is to get some kind of a bounce out of this to continue to compete with Sanders.
Let's hear a little bit from former Vice President Joe Biden. He spoke at a CNN town hall this week, as well as the debate. At this town hall, he said the Second Amendment is not absolute, and he was speaking about how he would convince defenders of the Second Amendment to go along with his ideas for gun control.
This idea that you're going to need an AR-15 or any other assault weapon, or you need any clip that has 100 rounds in it, is absolutely bizarre. You're a danger to yourself, if that's the case. Secondly, so it is no violation of the Second Amendment, period. And we didn't say anyone could own a weapon. From the very beginning, not anyone could own a weapon. So the idea that a terrorist could own a weapon, the idea someone who is in fact deranged could own a weapon, the idea someone who has a criminal background could own a weapon, that's why we worked very hard to pass the Brady Bill. I was the guy in the United States Senate at the time that moved the Brady Bill through and set up waiting periods.
So that's Vice President Joe Biden speaking at a CNN town hall this week. Dean, Joe Biden's comments on the Second Amendment likely to go over well with South Carolina Democrats?
To some extent, it's certainly a very important issue. Very important issue among Democrats nationally. Depending on the particular state, sort of guns are more or less central to the debate. It varies from place to place, obviously. Now, a lot of this Second Amendment discussion by Biden is really targeted at Bernie Sanders. You saw in the debate the other night, he went after Sanders on a number of votes in the past, dealing with gun manufacturer liability, dealing with other forms of gun control, and basically saying that Sanders has not been serious about gun control. Sanders always replies that he now has a D-, I think, from the NRA. But this has been a constant theme. One of the few ways that people have really focused on attacking Sanders, in addition to the cost of his various programs, is this issue of his previous votes on gun control.
Mm-hmm. Speaking of attacks on Bernie Sanders, I mean, that's the way of it when you are the front runner.
Absolutely.
You're going to draw the fire.
Yeah. We saw that.
Yeah. Well, yep. Pete Buttigieg, who did speak over Sanders, or Sanders spoke over Pete, depending on how you look at it. They spoke at the same time a lot during Tuesday night's debate. But Pete Buttigieg also suggested both President Trump and Bernie Sanders are stuck in the past. And he said this again at that town hall in South Carolina.
We are not going to survive or succeed, and we're certainly not going to win by reliving the Cold War. And we're not going to win these critical House and Senate races if people in those races have to explain why the nominee of the Democratic Party is telling people to look at the bright side of the Castro regime.
So Pete Buttigieg referring to Senator Sanders' comments about saying the Castro regime did some good things.
The literacy program, for example, is the one that specifically that Sanders mentioned.
Mm-hmm. So that's a weak point for Senator Sanders. But is any of this sticking? Is any of this hurting Senator Sanders?
Well, this is really a generational issue. So these comments versions of these comments by Pete Buttigieg, A, that Trump is a throwback to the 1950s, and B, that Sanders is a throwback to the 1960s. They've popped up in virtually every debate and town hall from the mayor. He used it in the South Carolina debate quite effectively the other night. It got a lot of replay on cable news and on social media. But it's really generationally. Younger voters are really taken with Bernie Sanders. He does really well with younger voters. You get up above 45 or 50, and you have older voters who remember the Soviet Union. They remember the Castro takeover in Cuba, and they're not quite as fond in terms of their memory. So all of this stuff, I think Buttigieg sees it as an opportunity. And he does well with older voters, but it really kind of plays mostly generationally.
And you mentioned that the first debate this month with Mayor Mike Bloomberg
in Vegas,
wasn't so great for Bloomberg. His campaign readily admitted that. The second time around in Charleston this week, Senator Elizabeth Warren attacked Bloomberg for his past support for Republicans. Bloomberg was a Democrat before becoming a Republican while running for mayor. He's also been an independent. So let's hear a little bit of Senator Elizabeth Warren.
Let's think of it this way. We're here in Charleston, and you know who's going to be in Charleston later this week is Donald Trump. He's going to be here to raise money for his buddy, Senator Lindsey Graham. Who funded Lindsey Graham's campaign for re-election last time? It was Mayor Bloomberg. And that's not the only right-wing senator that Mayor Bloomberg has funded. In 2016, he dumped $12 million into the Pennsylvania Senate race to help re-elect an anti-choice right-wing Republican senator. And I just want to say, the woman challenger was terrific. She lost by a single point. In 2012, he scooped in to try to defend another Republican senator against a woman challenger. That was me. It didn't work, but he tried hard.
So Senator Elizabeth Warren speaking at the debate this week, trying to sort of knock Mayor Mike Bloomberg down a few pegs. Dean, did she succeed?
Well, excuse me. Well, I mean, this you can hear from that quote, that comment. This is very personal for her. You know, her argument has been that Bloomberg has worked actively as a Republican to fund Republican contenders. That he has not adequately represented Democratic priorities or positions. And you know, she hit him really hard in Las Vegas, as did all the others. It was a bit of a trial by fire for him. But she continued to do that in South Carolina. And the question a lot of analysts had was, well, why? Her biggest concern in terms of getting the nomination is Bernie Sanders, and she kind of only went after him in a limited way. So both on the issue of his Republicanism, his support for Republican candidates, issues of sexual harassment, the non-disclosure agreements, she continues to hit him very hard in what seems to be kind of a personal way. But her bigger concern in terms of being the nominee really is Bernie Sanders and the overlap in the progressive wing of the party.
For the progressive wing, especially the cost of health care is super important this election cycle. Senator Warren, during a CNN town hall in South Carolina, highlighted her ability to bring the parties together by talking about her bill aimed at bringing down the price of hearing aids, which can cost as much as $5,000.
Talked about this with scientists, doctors, got the bill written. You know who the first person I called was? A Republican. And I pitched the idea, and he said, yeah, I'll do that. Second person I called was a Republican. The third person I called was a Republican. Did they want a couple of little changes in the bill and how we make sure there's certain notification? You bet. But the point is, I built it and did it under the radar screen because that was the right way to do that one. No fanfare, not try to make it fancy, don't need any headlines, don't need any credit for this. Let's just get it done. Now, there was a point where the NRA came out in opposition. Go figure. But by that point, we already had enough people signed on, and here comes the best part. Donald Trump signed that bill into law last year, and next year people will be able to buy hearing aids over the counter. So, we can work together.
So Senator Warren there making the case that she can work across the aisle. That's also the case we're hearing from Senator Amy Klobuchar from Minnesota.
Yes, Senator Klobuchar has run quite heavily on her record of pushing bipartisan legislation, that she understands how Washington works, how pushing a policy agenda works. Now, as we know in presidential politics, that's often viewed as a double-edged sword, and I think Pete Buttigieg has said, well, that's precisely her problem, is that she's a Washington insider. So that plays both ways. But yes, that's her best argument, is that she has that experience. And, the issue here with Senator Warren has been all along the cost of health care. And her argument has been for people who oppose Medicare for all and want to keep their insurance, the reality is it's going to cost them more. So one of her arguments here is that people are losing sight of the bigger issue, which is overall cost to the consumer.
Well, South Carolina's primary election this Saturday. Stay tuned to NHPR throughout the weekend for updates on the results as they come in. We'd love to keep you informed about what's happening in South Carolina and in the weeks to come. Super Tuesday, of course, right around the corner. Let's turn now to state epidemiologist Dr. Benjamin Chan for the latest on the coronavirus and the disease it causes, COVID-19. Dr. Chan, thank you very much for joining us. We really appreciate it.
My pleasure. Thank you.
So just to clarify this really quickly for us, when we hear about this new coronavirus, what does that mean? Why does it matter?
Yeah, so I think it's important to recognize that coronaviruses in general are a large group of, are a large family of different viruses. Many of these viruses we think only infect animals, for example, and there are actually only 7 known coronaviruses that infect humans. There's 4 that commonly circulate in our population, and it's estimated that these common coronaviruses cause upwards of 25 to 30% of all colds in adults worldwide. So these are very common. People in the community may hear about individuals being diagnosed with a coronavirus. Most likely that is someone with a common cold, for example. But there are these 3 other coronaviruses that have been newer or emerging, and we think have jumped from animals into the human population, and because of that have posed a more significant risk to the public's health. We saw this back in 2002 with the SARS coronavirus coming out of China. We saw this in 2012 with the MERS coronavirus coming out of the Middle East. And now we were notified at the end of December of this new coronavirus coming out of China, what's being called the 2019 novel coronavirus, and it's actually been retermed to coronavirus infectious disease 2019. And so the abbreviation we use now talking about the disease that this coronavirus causes is COVID-19 in order to differentiate it from the other coronaviruses that we sometimes have heard about or talk about.
Okay, well, thank you for the clarification on that. And is it a matter of when, not if, it comes to New Hampshire?
So I think that is the question that has been posed. Just to take a step back, this is a brand new virus, and we first saw this emerge about 2 months ago. And so over that time, we've been learning about the virus, and we've seen it spread very easily. Initially, it was coming out of Wuhan City, China, in Hubei Province, China. We have now identified, more than 83,000 cases in 50 different countries. So we have identified that this virus can spread person to person, and it can spread very easily. And in fact, there's several other countries now that are showing more sustained or widespread community transmission outside of China. So I think that we are likely to see more cases in the United States. We have identified some cases in the United States already, but we have not identified more widespread community transmission in the U.S. We have not identified any COVID-19 cases in New Hampshire, but I think it's likely that we will identify more cases in the United States and in New Hampshire. It is certainly possible that we may see this virus become more widespread in our communities. But right now, our focus, at least in New Hampshire, is working with our healthcare providers and healthcare systems to rapidly identify people who may have traveled to one of these more greatly affected countries, come back into New Hampshire, develop symptoms so that we can rapidly get them into care, testing, and then isolated so that they're not spreading it in our community. Again, we have not yet identified anybody in New Hampshire with COVID-19.
And how are hospitals preparing in case it does become more widespread? How are New Hampshire hospitals preparing?
So I just want to make clear that even though this is a new virus, and any new virus or any new infectious disease threat presents its own unique challenges, that our hospitals are able currently and prepared to be able to assess someone that might have COVID-19 and to initiate testing on them. Right. There are certain precautions that hospitals and healthcare providers take because we want to protect our healthcare system and we want it to protect our healthcare providers. And that includes, special isolation rooms and what we call airborne isolation. There's special personal protective equipment, so gowns and gloves, specialized, fit tested masks, eye protection that healthcare providers are required to wear whenever assessing someone that they suspect might have COVID-19. But these are all facility issues and equipment that hospitals and healthcare providers have in place currently. Mm-hmm. And so currently, hospitals and healthcare providers are able to assess and test someone if they're suspected to have COVID-19, and we've seen this take place in several hospitals around New Hampshire.
What should individuals do to prepare, in your view? Are there any precautions that you could recommend?
Yeah, I think that's one of the key questions that we're getting from concerned citizens and community members. We've seen this new coronavirus be able to spread very easily. We don't think it's as fatal as some of the other new coronaviruses we've seen, like SARS and MERS, but it is potentially more severe than just a regular flu season. And so there are steps that people can and should take to protect themselves, not only against COVID-19 if and when it presents in New Hampshire, but against the many other respiratory viruses like flu that circulate this time of year. The difference between this new virus and something like flu, they spread in very similar ways through respiratory droplets. But one of the key differences here is that, with influenza, we have a vaccine. A seasonal vaccine that we recommend everybody get. We have medications to treat individuals if they come down with the influenza virus infection, and those don't currently exist right now for this new virus that's causing COVID-19, this new coronavirus. Now, there are candidate vaccines that are in development and being studied. There are medications to treat COVID-19 that are being researched currently, but we don't currently have a vaccine to roll out. We don't currently have medications to treat this. And so a lot of the focus of prevention at an individual level and at a community level needs to begin with the everyday common measures that we talk about every year with flu. That includes steps like people need to pay close attention to good hand hygiene and frequent hand washing. People need to cover their coughs and sneezes, because this is primarily how this virus is going to transmit from person to person through respiratory droplets, respiratory secretion. If someone's feeling sick or has a fever, they need to stay home from school or work. Now, that's sometimes easier said than done, But that's an important part of preventing this virus from transmitting to other people and in our communities if and when it comes to New Hampshire. And then there's a role for frequently decontaminating frequently touched surfaces. Mm-hmm. It's certainly possible that someone who's infected with COVID-19 or influenza or any number of viruses to, touch their nose and mouth and then touch a door handle, and then somebody else comes along and touches that door handle and then, infects themselves. And so we need to be paying close attention to not only hand hygiene, but also frequently disinfecting frequently touched surfaces.
What about masks, those facial masks? Any advice on whether or not those would be effective?
Yeah, that's a great question, and that's something we've also been asked about. So for the general population, surgical masks are not recommended as a way to prevent becoming infected. But I think it's important to differentiate between, what we recommend for healthcare providers and what we recommend for people that may be ill or symptomatic, and what we recommend for the general, otherwise healthy population. For healthcare providers, there's a certain set of personal protective equipment with specialized masks that we ask them to wear if they're evaluating a person who they think might be symptomatic with COVID-19. There are patients, if they come into the office and are sick with fever or respiratory illness, we ask those individuals to put on just a plain, regular surgical mask in efforts for source control, right? So that someone who is sick is not coughing and spreading germs, whatever those germs may be. But for the general population who's otherwise well, surgical masks are not a routinely recommended way of preventing infection. So the focus needs to be on these other measures I mentioned: good hand hygiene, staying home when people are sick, covering coughs and sneezes, frequently disinfecting frequently touched surfaces.
Dr. Ben-Chan, we have this email question from Paula. She writes, I am a senior citizen planning to travel by plane to Palo Alto, California for 3 weeks starting next week. I'm visiting a relative. Should I cancel my trip? And what is my responsibility to my community in New Hampshire as a traveler?
Yeah, those are great questions, and we're getting a lot of questions about travel plans. And the thing we usually tell people is please talk to your healthcare provider if you're at all concerned about your health and travel. I will say that the Centers for Disease Control and Prevention has put out travel advisories for certain countries. That does not currently include any travel advisories for travel within the United States. Again, we have not seen widespread transmission of this virus in the United States, but there have been some detections in other states. And so if someone's concerned about their health and concerned about where they're traveling to, we encourage them to review the latest CDC guidance and their travel notices. We encourage them to talk to their healthcare provider. But in general, this is where the commonly recommended steps come into play of if you are traveling, try and avoid contact with people who are sick, especially close contact. And we define close contact as within 6 feet of an individual who's ill. So, social distancing. Make sure that you're frequently washing your hands and you're not, touching your eyes and nose and mouth and might inoculate yourself through your hands. So I think some common sense approaches like that can go a long way to keeping people healthy if and when they're traveling.
State epidemiologist Dr. Benjamin Chan, thank you very much for speaking with us. We really appreciate it.
My pleasure. Thank you.
And Dean, a question for you about COVID-19 and the history of it. So, a listener wrote in to ask, I read an article comparing COVID-19 with 1932 and the inability of the Hoover administration to deal with the crisis effectively and the possibility of the Trump administration's inability to deal with COVID-19 and the falling stock market. Do you see any such parallels, Dean?
Well, I will say is in general, there's always for better or worse, there's always a political component to dealing with this kind of an outbreak. There was back in 2002 with SARS and also with MERS. You may remember in 2009, we had the N1H1, the so-called swine flu, which hit particularly hard in North America. So absolutely, presidential administrations are always judged by their ability or inability to deal with crises. Sometimes it's sort of beyond their ability to control it. But people want to feel like they're getting good information, trustworthy information, and that the government has all the proper precautions in place. And so, certainly the Trump administration is acutely aware that they're going to be assessed along this, and they have a lot of concerns. The stock market has dropped tremendously in the last few days, and so sure, this is as much as you don't want to politicize this, There's always, whenever you're dealing with a public health crisis, certainly at the national level, and even also at the state and local level as well, policymakers will be assessed in terms of their ability to prepare.
This is the Weekly New Hampshire News Roundup on the Exchange. Coming up, Manchester Schools got a new strategic plan last week. NHPR Sarah Gibson is going to join us for a discussion of what's in the plan, what it hopes to achieve, and she'll talk about a variety of other stories that she has been covering. But we want to know from you what you think about the week's news. What's at stake for you and your family in the Manchester School District strategic plan? Email us. The address is exchange@nhpr.org, or you can post on our Facebook page, NHPR Exchange, which is where we've got a live streaming video of this radio program today. This is The Roundup. I'm Peter Biello. We'll be right back.
You're listening to NHPR. Good morning. You're invited to join NHPR tomorrow night for a live reporting of the South Carolina primary. Coverage begins at 6 o'clock with America, Are We Ready? A national call-in from WNYC. Then at 7 p.m., we'll be joining NPR's coverage of results coming from South Carolina. Tune in to NHPR. That's tomorrow evening at 6 or online at nhpr.org. Support for NHPR comes from you, our listeners, and from Listen Community Services, neighbor helping neighbor, turning used merchandise into community support, one item at a time. Learn more at listencs.org. And from New Hampshire Humanities, presenting ideas on tap, The Heat is On, New Hampshire and Climate Change, March 16th at Area 23 in Concord. nhhumanities.org/ideas. You're listening to NHPR.
On Monday, on The Exchange, we prepare for town meeting with town moderators in the studio to talk about the process and the biggest issues we will see on town meeting day. So listeners, what are the biggest issues in your town? Email exchange@nhpr.org. We'd love to bring your question into the conversation about town meeting on Monday. Right now, we're talking about the week's news with a few knowledgeable people. Dean Spiliotis, civic scholar in the School of Arts and Sciences at SNHU, and NHPR Sarah Gibson is joining us for this part of the show. Welcome, Sarah.
Thank you.
So among the things you've been covering this week, there's a new investigation that the state attorney general has joined into Juul, the vaping company. Tell us a little bit about this investigation. What are they looking into?
Sure. They're looking into the marketing and sales practices of the company Juul, which is kind of the top dog for vaping products in the U.S. And they're joining 38 other states. So it's a really big investigation. The idea is that if you have tons of attorney general's offices across the U.S. looking into marketing practices and whether or not Juul was violating consumer protection laws in these states, they can basically pool resources and share information. We don't know what this could lead to, nor how long it will take. It could be months. It could be more than a year. They just started this week.
And to what extent is this focused on the safety of young people vaping?
That's certainly part of it. There's also how they may have targeted youth is a question. Also, questions about nicotine content, risks that were communicated or not. So it's pretty holistic. Mm-hmm.
And people have died from vaping-related illnesses. Yes.
Yes.
I mean, so is that a big concern here as well?
It is a big concern. The rate has decreased a little bit in the last couple of months. We kind of saw that big explosion of concern and health issues in the fall. But the thing that's referenced in the press release that various attorney generals put out is more of this question of youth becoming addicted to nicotine through Juul, that allegation. So that's more what they've been focused on as the impetus for investigating the company.
Because states have put a lot of resources toward keeping young people from smoking in the first place. Yeah,
exactly.
Okay. So what might result from this investigation? Like fines, penalties of some kind?
Yeah, potentially fines and penalties. But again, it's so early. It's really, really hard to know how severe those penalties would be were the states to find that Juul had in fact violated consumer protection laws.
Mm-hmm. And no word yet on actually when the investigation's scheduled to come to a conclusion?
No, not at all.
Okay, still too early for that. Mm-hmm. All right. Other stories the NHPR newsroom has been following this week. An Upper Valley nonprofit working to help survivors of gender-based violence called WISE says the area's housing shortage is making it more difficult for the people they serve to find stability. The Upper Valley has one of the lowest vacancy rates in New Hampshire and rising rental prices. WISE and 2 other Upper Valley nonprofits applied for a federal grant that, if awarded, would provide housing subsidies to survivors. Also, representatives of New Hampshire's waste industry urged House lawmakers yesterday to vote down a bill that would temporarily halt private landfill construction in the state. The bill would impose a 2-year moratorium on permits to expand or build new private landfills. In the meantime, the state would look into building more public landfills. Environmentalists and local advocates spoke in favor of the plan, but state regulators opposed it, saying it would strain the state's dwindling landfill capacity. And new data from this month's presidential primary shows that Democrats have narrowly overtaken Republicans as the dominant political party in New Hampshire. Democrats account for roughly 31% of the state's registered voters. That's compared to roughly 30% for Republicans. It has been nearly a decade since Democrats have outnumbered Republicans in the state's voter rolls, though it is not uncommon for those numbers to fluctuate between election cycles. And Sarah, I want to return to the question of charter schools for a moment, because New Hampshire has been offered tens of millions of dollars for these schools. Democrats have blocked this money so far, these grants that some in the state want to accept, others not so much. Where do things stand now?
Well, things stand, they're kind of at a standstill. So basically there is a bill that is being considered that would basically allow the DOE Commissioner, Frank Edelblut, to take the funds, even though the fiscal committee has said, no, we're not going to take this money from the feds. And they've been saying that actually since late last year, since December meetings, they've been saying, the Democratic majority on this committee has been saying, we are concerned that this could actually cost the state down the road. It's not fiscally responsible to take money to expand the number of charter schools in New Hampshire, so we are going to say no thanks. But basically, the DOE commissioner says it is his duty, and in fact, by law, he has to keep on seeking these funds. So we're probably going to see the proposal to accept these funds continue coming back and back and back to the lawmakers.
Mm-hmm. And any movement at all, or is it just going to keep coming up and getting shot down?
Again, there's a bill that would a bill proposed by Republicans that would allow the DOE commissioner to take these funds. However, it's a little hard to imagine that having a ton of success, since most Democrats do seem opposed to this money.
Okay. Senator Jeb Bradley, a Republican, has said that Democrats are making it harder to establish schools that would help kids with special needs in particular. Charter schools are often cited as an example of the way kids with special needs can get the help that they need, the attention that they need. Is that a fair criticism coming from Senator Bradley?
It's really hard to say, Peter. So anecdotally, particularly on during testimony to the fiscal committee, we've definitely heard from students who are not succeeding in their traditional public school and went to a charter school that was really oriented towards students who were not, or maybe diverse neurologically, or maybe had technically had, an IEP, which is a special education plan, or just were struggling in their school. And, they and their parents and their teachers have said a smaller and more creative and freer environment has actually been great for these students. They're really succeeding far better. The metric for that is hard. I mean, we're not seeing that necessarily in performance scores at these test scores at these schools. And I will say that I have talked to people who are involved in special education services at traditional public schools, and who say, just as we hear stories of students doing far better in a charter school, we also hear stories of students really struggling at the charter schools and having to return to their traditional public school precisely because the special ed services at that charter school were not sufficient. So I think if you dig a little bit deeper, you'll hear claims on both sides. But certainly, the stories we've heard in the last couple of months from charter school advocates is that charter schools can be a great place for students who are not doing well in their traditional public school.
Okay. And with respect to this fight over that money between Democrats and Republicans, do you see any areas of compromise? No.
I don't necessarily see a ton of room for compromise. I will say that one of the things that Democratic lawmakers opposed to this funding have said is we want to make sure that there's robust and fair funding for existing charter schools. Let's focus on the charter schools that are already open that seem to be having some financial challenges. So there's a big push right now in the State House to look at adequacy funding, basically how the state funds schools. And it could be that, I've heard from both sides of the the aisle, let's re-examine how much money the state sends to charter schools, and particularly for special ed costs, like really make sure that charter schools do have good financial footing. So it seems like there's concern and interest from both sides of the aisle on that one.
Mm-hmm. Listeners, in just a few minutes, we're going to be joined by Congressman Chris Pappas. He'll be talking about a variety of things, including the VA's recent issues paying private sector healthcare providers for treating veterans under the VA Mission Act. Are you a veteran who has been impacted by the VA Mission Act? Is the VA paying your private health care provider on time? Whether you are a veteran or not, this is a chance to ask Congressman Pappas your questions about anything happening in the House. Email us now so we can bring your question into the conversation. The address is exchange@nhpr.org. You can also comment on our Facebook page. That's NHPR Exchange. Sarah Gibson, last week, Manchester Schools got a new strategic plan last week. Back up a little bit and tell us about the need for such a strategic plan, because this has been in the works for a long time.
It has, yeah. And, a lot of districts have strategic plans. This one has a little bit more muscle behind it and community input behind it than a typical plan. So basically how it started was nearly around 20 months ago. Business leaders had been discussing the need to improve Manchester's public schools. There was actually, among business leaders, a real concern. We're having a hard time, retaining and attracting young families because there's a reputation that Manchester schools are not very good. And so there was close to $860,000 were raised by local foundations, by business leaders, to basically do a very, very broad community-based survey process that the idea was, engage schools, engage educators, engage families, students, community members to really see, what are the strengths of Manchester schools and what are the areas we need to improve. So that lasted for months and months and months. And then there was essentially a vetting process.
A vetting process of possible plans?
Of possible plans. And the group behind this was Manchester Proud. And basically, they would put forth, kind of hunches, ideas. Here are areas we could improve. And the community groups, as well as the school board, would say yes or no. And so the final plan that was presented last week, it had the buy-in from the superintendent, which is pretty important, and it had a lot of buy-in from the school board members. There was just one person who voted against it. So it certainly does not mean that Manchester is about to do all of the recommended tasks from the strategic plan. However, it does seem like it'll be a real roadmap in the coming years, and there will certainly be discussions about how much it will cost, what existing services can be cut so that, some of these initiatives can come to fruition. So it's really just the beginning of the conversation in terms of what of the strategic plan we will see in the coming 3 years.
So it's a 3-year plan.
It is.
What are some of the things that are in it?
Well, there are so many, Peter. So an overarching goal is equity. And we've heard this, for years now, that in Manchester schools, there is a real gap in performance, achievement, and opportunity for low-income students and students of color. This is, New Hampshire's most diverse district and has a very, very high rate of low-income students. And many of them are struggling to succeed. And so it has everything from hiring an equity coordinator to improving wraparound services for students who may be coming from difficult family environments.
Wraparound services like social services at home to make sure that they get to school in the first place?
Yeah,
okay.
Everything. It's wraparound services is by definition broad.
Okay.
But yeah, social services for those students. There's also things like proposing magnet schools that could potentially draw students from outside of the district who are interested in particular subject areas. And then some other things that are going to be probably pretty contentious, such as adjusting staffing levels. We see that there are a lot of often really crowded elementary schools, but the high schools have plenty of room and have seen a real attrition of enrollment. So the idea is to, when teachers retire in Manchester, particularly in the high schools, to not start hiring more, to really adjust the staffing levels so they reflect the needs of the district. And then also there is a proposal to look at the school board and whether or not it potentially has too many members. So there could be a kind of a rejiggering of that. And then one other thing that I thought was pretty interesting is reducing the class size, kindergarten through fourth grade, to 20. And related to that is this goal that the superintendent also has for all students in third grade to reach reading proficiency. And that's actually a pretty high bar for Manchester. It's not there yet. And that would involve both academic initiatives as well as other initiatives that many proponents of this plan claim aren't specifically oriented towards academic performance, but would help the student with social and emotional skills such that they could learn better in the classroom.
Mm-hmm. So as you continue reporting on this, Sarah, what will you be watching for?
Well, I think this question of equity is really big. And last week, there was critique of the plan, and there was critique of the school district saying, we really need to figure out how to have parents play a role in their kids' education, and that's a really, really challenging task when so many of the students' parents, don't necessarily speak a ton of English and feel very excluded from the processes that their kids are involved in. So there's a real, really creating an equitable educational system in Manchester is going to take, could potentially take years and a ton of organizing and a real paradigm shift in the district.
Mm-hmm. So if you were to want to hear from folks in Manchester, what would you want to ask them? What would you want to know from them? They can email us and we'll forward it to you, exchange@nhpr.org. What would you want to hear from people?
Sure. Well, I've heard a lot of critique, and I'm happy to hear that as well. Concerns that make it hard for your child or the students you see to succeed in schools. But I'm really curious what kind of models you're seeing that are working, because there are so many schools in the Manchester School District, and some of them have been piloting these pretty innovative, interesting approaches to addressing concerns about equity and performance of students. And I'm curious if you're seeing that your either your child or neighbors are really succeeding in part because of some of the initiatives that have been put in place, particularly in some of Manchester's elementary schools.
Well, if you'd like to inform Sarah Gibson's reporting, send an email now to exchange@nhpr.org. Sarah Gibson, thank you very much for speaking with us. Really appreciate it.
You're welcome.
Listeners, we're taking a look at the week's news, and coming up after a quick break, we're going to speak with Congressman Chris Pappas. What questions do you have for him? Send us an email. The address is exchange@nhpr.org, or post on our Facebook page at NHPR Exchange. We've also got a live streaming video of this radio program there. So this is the Roundup. We'll be right back.
Hi there, I'm Sam Evans Brown. Did you know that you can use your smart speaker as a radio? It's true. Anytime you want to hear the latest news and all your favorite programs like Morning Edition, Marketplace, and Outside In, just ask your smart speaker to play NHPR.
America is told to brace for coronavirus. Harvey Weinstein is found guilty, and Kobe Bryant is remembered in the house that he built. The Friday News Roundup next time on 1A.
That's this morning at 10 here on NHPR. Support for NHPR comes from you, our listeners, and from Lexus, presenting the Lexus NX, combining connectivity with design, available 10.3-inch multimedia display, and perforated leather trim seating. Lexus, experience amazing. Partly to mostly sunny for most of New Hampshire today. Mostly cloudy, a chance of snow showers from the White Mountains north. Windy statewide, gust up to 30 miles an hour. Highs today upper 20s to mid-30s. You're listening to NHPR.
This is the Weekly New Hampshire News Roundup on the Exchange on NHPR. I'm Peter Biello. We've got Dean Spiliotis, civic scholar in the School of Arts and Sciences at SNHU, still in the studio with us. And we turn now to Congressman Chris Pappas, who is on the line with us. Thank you very much for joining us. Really appreciate it.
Good morning, Peter and Dean. Great to be with you.
Congressman, I want to start by asking you about some of your efforts to make sure the VA is paying private sector healthcare providers who treat veterans. The union leader reported this week that there was $134 million in claims waiting to be paid. I understand that there's been some commitments from the VA this week to help pay that, but I wanted to get your insights about why there was such a backlog. Why, from your perspective, was there such a backlog?
There are a number of things that have contributed to this problem, which is really frustrating providers all across New Hampshire that are seeking to provide quality care for our veterans. And this has been going on for a number of years as the VA has partnered with different community providers to try to expand the options that are available to our veterans. And so from the very beginning of my time in Congress, we've been working very closely with individuals and providers to try to get them paid in a timely fashion. We've had some success, but this has become a bigger issue, and it's come into focus because the VA in this particular region has switched its third-party administrators, the folks that are contracted to do billing for VA. And as one of these contractors left New Hampshire and another came in, there was a changeover and a transition of systems where we really began to see the scope of the problem.
But this isn't really a New Hampshire problem, is it? It's also other states are experiencing the same thing, yes?
Well, different parts of the country have different third-party administrators that are doing billing. And so in this region, we have seen 3 transitions over the last several years. In other parts of the country, they haven't necessarily seen these transitions. But there are other issues that also contribute to this. One of them is emergency care. There's a lawsuit right now on how the VA pays emergency care claims, and so the VA has been hanging on to these claims and not paying them. In addition to that, if you talk to some of these VA contractors, they'll tell you that late last year there were some serious kinks in the payment process, and they're working hard to deal with that backlog. So this has always been really frustrating to deal with the Byzantine bureaucracy over at the VA, and so there are a lot of issues that are contributing, but I think right now we need all the players in the room to be focusing on how they can unkink these lines and really make sure these providers get paid, because the real risk here is that providers walk away and don't want to offer care to veterans, and that's the last thing we can afford. We always got to be thinking about that end veteran that sacrificed everything for this country and make sure they have the best care possible.
You sent a letter to the Veterans Health Administration in late January asking for the VA to explain when all the quote, outstanding legacy claims under TriWest, the contractor, will be paid. Did you receive an answer to that question? And if so, what was the answer you received?
Well, we haven't received enough of a detailed answer, and we continue to insist on more detail, both from VA and TriWest. We will continue to look for ways to, bring all these parties together. We've had several meetings in New Hampshire with our hospitals and with the provider community. We'll look to do more of that to get some very, localized attention to this matter. But there are major discrepancies between what TriWest is showing on their books and what hospitals are showing on their books. There have been a lot of claims that have been denied for no apparent reason, or for reasons because there was a coding error or the authorization wasn't processed appropriately. So you can really get down in the weeds on this issue and see a number of reasons why this has become such a serious problem for these providers, especially over the last few months. And we're going to continue to insist that everyone gets together to solve this.
The payment issue has been a story that we've been reporting on for years. It was an issue under the Veterans Choice Act, passed many years ago, and the Mission Act, passed recently, or more recently, was kind of sold as a simplification to the Veterans Choice Act. It would help avoid this kind of payment issue. But here we are, similar issue. So in your view, is the Mission Act just as flawed as the Veterans Choice Act?
Well, I think that there have been improvements, and there have been systems that have been put in place at VA that allow for quicker payment in some cases, but we still have some serious outstanding issues. Some issues that date back, over a year, back to the previous third-party administrators. So, this continues to be a problem that we need a short-term fix for to make sure that these providers are paid in an efficient and timely fashion. But we got to look over the horizon too to make sure that the systems are in place so that we're not right back where we started from. VA is committed to doing that, but there are technological systems that need to be innovated and other processes, and that is going to take a little bit more time.
You say the VA is committed to doing that. Has VA Secretary Robert Wilkie or someone high up in the chain of command committed to a timeline to get this all fixed?
They've committed in public hearings and in private meetings with me that by the end of this fiscal year, that's at the end of September, they would have all these legacy claims dealt with. And so we're going to hold them to that timeline, but we're going to insist on accelerating it as quickly as we can, especially for those smaller providers in New Hampshire, the acupuncturists, the massage therapists that care for our veterans, that they get paid because, they're more sensitive to these outstanding invoices.
And to what extent do you think the Manchester VA can fix this, or is this something that the VA in D.C. has to address?
Well, the Manchester VA has responded, and they are creating deployment teams that they're hoping to send out to some of these providers to work with billing departments at local hospitals and other community providers to try to find out where the issues lie and how they can work through them. But this is an issue that goes well beyond the Manchester VA because some of these, hospitals, for instance, are dealing with not just Manchester VA, but White River Junction and Boston. And so this really has to be a regional and a national approach to be able to address this. So we're, dealing with folks at all levels of VA, and, they're saying the right things, but we need to continue to insist on more action. This shouldn't have gotten to the point that it is today because, as I said, it's threatening the care that our veterans depend on.
In that letter in January, you also asked the VA about the VA's, quote, lifetime maximum on the number of visits for alternative care. Veterans listening might want to know exactly what that is. What is, first of all, the alternative care and your concerns about the lifetime maximum that the VA imposed?
So there is great alternative care that is available in the community that VA has been contracting for. So I have had the opportunity to get out there and meet not only with providers but with veterans who are receiving this kind of care. I was at an acupuncturist recently in Laconia and met with some of her patients who talked about how they're receiving acupuncture and not having to take pain medication anymore to manage their pain or PTSD. And I just think that is a wonderful thing to see, and their quality of life has improved as a result. There's some question around lifetime caps for some of these visits. We've asked questions about what exactly new rules mean in terms of the number of visits that these folks can use under their VA care. We haven't received an adequate answer yet, and we're going to continue to insist on that because, frankly, these visits are saving money in terms of prescriptions, and they're, resulting in better care offered to these veterans and better outcomes. So I think it's a wise use of our dollars, and we should, look to really, cap that level of care because it's so needed.
Congressman Pappas, stay with. Thank you very much for answering questions related to veterans' health care. Dean Spiliotis of SNHU has a question for you.
Yeah, hi, Congressman. You just mentioned prescription drugs and pain meds, and granted, staters continue to deal with the high cost of prescription drugs, and it's gotten to the point now where the New Hampshire state legislature, as well as other state legislatures, have decided not to wait for federal action. And you've expressed significant concern about this issue as well. So I was just curious if you feel like Congress is making any progress on cost and availability.
We have to get something done. The House has passed a package. The bill's called H.R. 3, and it's a bill that requires the drug companies come to the table to begin negotiating the cost of prescription drugs. I mean, there's no reason that Americans should be paying costs that are several times higher than any other nation in the world. So price negotiation can bring down these costs. That's something we do, for instance, in the VA system, and the result is a lot better for folks that need these life-saving medications. So that's a basic step we should be taking. We should also be capping out-of-pocket costs, especially for our seniors on Medicare. That was something contained in the House legislation. So we've seen legislation floated by members of the Senate, including Senator Grassley on the Republican side, and I'm hopeful that that legislation can move forward in the Senate so that we can come to some sort of a compromise on how we can move forward to reduce costs and ensure that medications are within reach of individuals.
Do you have any sense of how difficult or easy reconciliation would be between the H.R. 3 and whatever comes out of the Senate? I mean, what the key sticking points might be?
Well, it shouldn't be very hard if we're listening to our constituents, right? I mean, if you're out there and hearing stories, which I do each and every day, they're very present and they're very personal. So that should provide the impetus to get something done. I think, everyone is saying the right thing at a top level, from the White House to leaders in the House and Senate. So let's make something happen. I don't think we need to wait for another election to get something done. We've heard the voices of the American people loud and clear, and the pieces are there. So I think an idea like capping out-of-pocket costs is something that is common both to the House legislation and the bill that Senator Grassley was working on. So if we can get that, let's move forward on that idea. That could be something that would really be a game changer for a lot of folks in New Hampshire.
One more question, Congressman. This is a political question. Many of the Democratic presidential candidates, including Bernie Sanders and Pete Buttigieg, Elizabeth Warren, Amy Klobuchar, have all recently announced that they're skipping next week's AIPAC conference in Washington, D.C. This is the American Israel Public Affairs Committee. And Senator Sanders in particular has expressed concerns about the Israeli government respect for basic Palestinian rights. I think you're scheduled to participate in that conference. Do you share any of the concerns expressed by the Democratic candidates?
I think we should always look to have an exchange of ideas, and we should also look for ways that we can not only support the security needs of Israel, but also to create a long-term peaceful resolution to the conflict that's existed in that region for a long period of time. So I'll be attending, and I'm actually on a panel that deals with LGBTQ issues with one of my colleagues. We're co-chairs of the LGBT caucus in the House, and so we'll be talking not only about the U.S.-Israel relationship, but also about the LGBT community here and in Israel, and how we can work together to extend equal rights to all individuals.
Congressman Pappas, Congresswoman Annie Kuster, before the New Hampshire primary, gave a strong endorsement to Mayor Pete Buttigieg. I don't believe you've endorsed anybody yet, but how about now on the eve of the South Carolina primary? Are you ready to make an endorsement for any of the Democratic candidates still running?
Well, I applaud Annie for her enthusiasm and for getting out there. For me, I really wanted to make sure that voters of New Hampshire were, rendering their verdict and making their choice, and we're out in front of this process. And I think they did a nice job. I mean, people came out in record numbers on both sides, and I think that it was a very spirited contest. So I don't intend to endorse anyone. I think that the voters of this country are going to figure this out. This is a long process. New Hampshire's lucky to go at the beginning so we can help shape the field and shape the terms of the national debate. And I'll continue to watch things as they move forward. But to be honest, there are lots of different scenarios and ways this could go. And so I'm just going to focus on what I'm doing here in Washington and, the work we have to do back in New Hampshire to get some things done.
Okay, so you don't want to endorse, but, you've said in an interview months ago that the country needs someone who can appeal to the middle without naming names because you don't want to do that. Is there anybody currently running who would fit the bill?
I think a number of the candidates have a capability of building the sort of big tent that I think any candidate for president should seek to build. And so, I hope that regardless of who you are or what you stand for in this race, look at what happened in 2018. We had a very robust primary in our congressional race that year. 11 candidates in the race, very diverse sets of opinions on a variety of issues, including health care. At the end of the day, we realized that the differences between us were pretty minute compared to the differences that we had with the other side, and we quickly came together to win a pretty tough race last fall in 2018. So, I think that Democrats are capable of doing this at the national level. It's going to take leaders, regardless of their past statements or positions, to really look to bring people in and run an inclusive kind of campaign.
Well, Congressman Chris Pappas, thank you very much for speaking with us. We really appreciate it.
Thanks for your time. Great to be with you.
And I want to thank Dean Spiliotis, Civic Scholar in the School of Arts and Sciences at SNHU, for joining us today. Dean, thank you very much.
My pleasure, Peter.
Also grateful to Dr. Ben Chan, State Epidemiologist, and NHPR reporter Sarah Gibson for joining us on the program today. Remember, the conversation continues about everything we've heard today at nhpr.org and at our Facebook page. Searching for NHPR Exchange, you can find it there. The show's producers are Jessica Hunt and Christina Phillips. Senior producer is Ellen Grimm. Michael Brinley is our program manager. Dan Toohey is working the cameras today. Our theme music was composed by Bob Lord. The engineer is Dan Colgan. I'm Peter Biello. Thank you very much for listening, and have a great weekend.
The views expressed in this program